Hello, I'm Dr. Perry from Farmington Family Dental. Today we're answering some of the most common questions that I see about all-on-4, all-on-X, or implant-supported bridges are the different names for this procedure or technique. All-on-4 refers to placing 4 implants and putting a bridge or a fixed dental prosthesis over the top of them. That's something that doesn't come in and out of the mouth. It's screwed into the implants and doesn't move. This tends to be a great restorative option for somebody who has typically 6 or fewer functional, good intact teeth per arch, and typically works pretty well on the bottom and on the top jaw. The pros of all-on-4 is it's the best high-performance restoration that I can deliver in that it doesn't move around. The alternatives that I see for it are something like a denture. Obviously, dentures have their problems. This is the Ferrari of the dental world. It's high performance, and I think by extension on that, the con on this is the maintenance required for it. It requires maintenance, and those maintenance procedures can be anything from replacing it to repairing it to redoing things that break along the way. A good candidate for all-on-4 implants or prosthesis is somebody who has good, healthy, sound bone, who has poor teeth that are existing in the mouth, but they have good oral hygiene and maintenance protocols. Things have just gotten away from them throughout their life. They're wanting something that looks very nice and performs well, and their expectation is to have something in there that allows them to chew and smile like they once used to be able to, or improving on what they once had if they had major dental issues even as a kid. That type of person tends to be the ideal person for this treatment. Acceptable is somebody who they're missing all their teeth. It can be placed and restored that way. Oh, the most common poor candidate that I see, people who come into my office, are those who there are other good options for them. Typically speaking, and this is just in general, if it's possible to fix things up without major compromises to its longevity, I'm going to recommend that route before we go towards taking everything out and replacing it. There are some nuances to that. If you come in, I will talk with you specifically about what's going on in your mouth, and I'll talk about some of those nuances or limitations. All-on-4 procedures are typically done in 4 steps, but this can be extended depending on how the surgery goes, how things respond in healing and whatnot. Typically, the first step is the planning phase of things. We get in there, we plan out what we're doing. Typically, we're either planning a surgical guide or we're doing it without a surgical guide. And that's just how we execute on the work. Then there's the surgery day where we already have prepared a denture. In worst case scenario, if you have to wear a denture for a little bit, we have prepared 2 impression material and impression equipment to capture where the implants are, where the bone is, and where the soft tissue is. The next step is putting in a temporary bridge. As long as the implants had enough hold in across the implants, we'll put a temporary bridge on over the top of them. That temporary bridge stays on there for a couple of months and then is the final stage. Those are the 4 steps most all-on-4 patients go through to getting the final prosthesis or the final bridge on over top of the implants. So anesthesia. Sometimes there's a lot of concern about this. Okay, am I going to feel it? I want to be asleep. You know who you are. So there are 2 options fundamentally on dental anesthesia for something like this. The first option that is my go-to is just get everything numb and comfortable so you're not feeling anything and get the work done. That can be done comfortably in a lot of cases and is the cheaper of the 2 options, by the way. That's just getting it numb normally. That works great. Second option, I can bring in an anesthesiologist. This is a board-certified anesthesiologist, by the way. This isn't a nurse practitioner. This isn't me doing the anesthesia and the surgery at the same time. It's a separate individual who comes in and sedates. That sedation can be anything from a deep sedation, like you're kind of asleep and really not aware of what's going on, all the way asleep. You're not going to wake up. You're not going to know. When you do wake up, everything's done. You didn't even have to hear it, feel it, see it, or smell it. The healing time, so what's involved with that? How long does it take? That really depends on what other procedures are needed in placing those implants. Typically, the implant itself, healing in and around the bone, takes about 6 months. They can take as little as 3 months and as many as 8 months, depending on what else was done in and around the implant. But average is about 6 months. The longevity of All-on-4 really depends on the two caveats that I'm about to talk about. Average is about 20 years is what we're seeing from these prostheses. To about 15 really depends on how much force is on them and things like that. But as long as you're not smoking or diabetic, that's typically what I see is a good long lifespan. That is assuming too, by the way, that you have the soft tissue grafting procedures that are needed in and around the implants to give the best result, not just a basic result. Cost of All-on-4 dental implants varies a little bit depending on what kind of materials we use, but what I typically see is anywhere from $25,000 to $30,000 per arch. So when somebody's doing top and bottoms, it's going to sit somewhere between about $50,000 and $60,000 to accomplish something like that. Insurance, what does it do when it comes to All-on-4s? Typically, I see that they really don't contribute in a meaningful manner. Sometimes they'll take a few thousand off, and it really depends on your individual insurance. When it comes to planning on All-on-4 or something like that, that is the Ferrari of the dental world, insurance will say, well, they don't want to pay for it. They're happy collecting your premium, but not actually paying out. So what I find is they really don't meaningfully contribute. More than about a 10% or so is probably the best case scenario that I've ever seen. You can schedule an appointment by giving us a call. Call our office at 573-756-5760. We'll get you scheduled in. Our first visit will be sitting. We'll take records. We'll see where the bone is at. We'll take a look in your mouth, and it will be a conversation with us. And we'll see what you need, what you want, and how we can deliver it for you. Okay, hopefully this information that we've done so far has been helpful for you in deciding, do I want All-on-4? What do I need? What do I want to do with the situation going on in your mouth? If you're interested in our help with what's going on in your mouth, give us a call. Our phone number at Farmington Family Dental is 573-756-5760. We'll get you scheduled in. We'll get you taken care of. Thanks.